Today I am going to talk about some important and uncommon aspect of complications of diabetes, because many patient, the male patients who come to us, they talk about lots of complication like neuropathy, nephropathy, even the cardiovascular issues, but there is a one important component patient, because of sinus they did not mention, is that erectile dysfunction, and that is a very important complication of diabetes, and that need to be addressed as well. So, whenever a male patient of middle age or even younger, because it has been known to affect the younger diabetic patients as well. So, they come to us, we need to evaluate the components of erectile dysfunction, that is also a component of both neuropathy as well as vasculopathy of the diabetes complications, because and as well as there is a component of hypogonadism which is coexist with the diabetes sometimes, and especially in the middle age to elderly patients. So, all this combined together has a serious concern and comorbidity for the patient for erectile dysfunction. So, all the patients whoever come to us, we need to evaluate the patient for history of erectile dysfunction, whether the morning erection is present or not, history of libido or other complications of hypogonadism, like even the history of gynecomastia may be sometimes present, and these complications together, and we can also need to evaluate the, if there is problem, we can also go for Regiscan or other significant tests for erectile dysfunction of the patient, and the neurological component which need to be excluded for other cause, for example, the spinal injuries, other neuropathy, plexopathies, and even the vascular disorders need to be excluded as well for the patients. So, this important disease is a important, as I feel, need to be evaluated for all the male patient who visit to our clinic, and that helps us to treat the diabetic patient in a wholesome. Thank you.